Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1.
Extract 1. Questions 1 to 12.
For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, doctor. I am Bernardito.
Good afternoon. May I know what your problem is?
I am having a severe stomach ache.
What do you feel?
I have heartburn and severe pain, doctor.
Since when have you been feeling this acidity and pain?
For the past 2 months. My stomach hurts after every meal. The pain persists even during nights.
Have you eaten any heavy food or something different in the last 2 months?
No, actually.
How severe is the pain? Let's say on a scale of 1 to 10, how would you scale the severity of the pain?
Well, I can say between 4 to 5.
Is the pain continuous?
No, it hurts only fleetingly.
Do you feel the pain after meals?
Yeah, probably, because it hurts every time after I eat.
Is there any kind of food that bothers you much?
Yeah, greasy food.
Oh, I see.
Yes, at home we eat a lot of greasy food.
Where in the abdomen does it hurt? Tell me the exact point. Does the pain shift to your chest, shoulder, back, or across your abdomen?
It hurts in the middle. At times the pain moves across my abdomen.
Besides the pain, you said you have heartburn?
Yes, I feel a kind of sour taste whenever I burp.
Do you feel like this more during the day or in the evenings?
Both. I feel the acidity during the day and at night.
Is it getting worse whenever you lie down?
Yeah, I get an acid-like taste in my mouth.
Besides greasy food, are you getting some irritation in your stomach when you eat any other kind of food, like spicy food?
No, actually, we don't eat spicy food at home.
And tell me, how frequently do you have a bowel movement?
No, it hasn't changed. It's regular.
And tell me, how frequently do you have a bowel movement? And has there been any change in your bowel movements for the past 2 months?
Yes, it has become a little bit softer.
Is there any change in the color?
Yeah, it is greener.
Greener and not darker? Any blood in your bowel movement, or is it darker?
Not darker. And there wasn't any blood in my bowel movement.
Okay, let's first diagnose your abdomen to check from where the pain comes. You said you are feeling pain at the middle part of your abdomen.
Correct.
Does the pain stay there only, or does it move somewhere else?
It usually stays there.
Do you feel acidity and heartburn during the pain?
Yeah, you were right.
Do you have vomiting or nausea?
No, not now.
What did you eat today?
I ate meat and tomato sauce.
Do tomatoes give you any trouble?
Not exactly. I have been eating tomato sauce always.
Do you get any trouble when you have orange juice?
Yeah, at times.
How do you feel then?
I get a strange metallic taste.
You do not feel acidity then?
No.
Now, tell me, what do you do whenever you get stomach aches?
I take Alka-Seltzer at times. That gives me a relief from the pain to some extent.
Yeah, that should help with the relief. Do you take any Maalox, Tums, or Mylanta?
No.
Have you ever taken any medication on a consistent basis such as Advil, aspirin, or Motrin?
I was taking Tylenol usually.
Okay, as I told you earlier, I'm going to examine your feces to investigate whether you have any kind of parasite. Tell me, do you either come from the tropics or have you ever been traveling to any of the tropical regions or overseas?
Yeah.
Parasites that are found in most of the parts of the world affect the stomach. Besides, I want to check for any occult blood. You have mentioned earlier you haven't seen any changes in your feces and it's only greener and not darker. Sometimes if you have a hemorrhage in your stomach, then the digested blood could produce a chemical reaction so that you can have occult blood in your feces. In such cases, we don't see the red color or dark color of the digested blood. Therefore, a diagnosis is essential. Moreover, I would like to diagnose your upper gastrointestinal system through x-rays and contrast. You will be given a thick substance to drink, and then the radiologist would observe how your liver digests the substance and observe your stomach movements. Because I think that your pain comes from your gallbladder and not from your stomach, I will have to do this kind of diagnosis. After a thorough investigation, let me decide whether I should take the x-ray test or an ultrasonic study of your gallbladder. Do not eat any greasy food for now, and also do not have your dinner just before going to bed, because it could produce more acidity. Eat normal food and nothing spicy. I shall get back to you as I receive your medical reports from our lab. Anything else?
With so many medical tests, I'm afraid I have an ulcer.
I too have that kind of doubt. That is why I have suggested all these tests. I need to explain to you that an ulcer or other irritations in your upper intestines cannot be detected by x-ray at times. If the pain continues after having some antibiotics, you may have to go for an endoscopy. An endoscopy is a medical investigation in which a tube will be inserted through your mouth or nose, and then the specialist will observe your stomach, from the small intestines to the large one, and your gullet. Do you need any clarification?
No, doctor, thank you.
Good. Let us meet next week. Goodbye.
Extract 2. Questions 13 to 24. You hear an optometrist talking to a patient called Dominica. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Good morning, Mrs. Dominica. How can I help you?
Good morning, sir.
Can you show me your registration card? Or should I search your details through your mobile number?
I think that would be better. My mobile number is 078-823-78979.
Okay, I've tracked your record. You last visited on the 27th of August 2016.
That's correct.
Just pay the doctor's consultation fee here.
Sure, this is my card.
Please take your seat and feel comfortable. Should I help you with water, newspapers, etc.?
Thank you. Hello, doctor.
Hello, Mrs. Dominica. So how can I help you?
I just came for a regular checkup for a suspected case of glaucoma. 18 months ago, Dr. Gonzalez advised me to undergo a precautionary checkup once a year, knowing my family history of glaucoma and after examining my eye. He told me that my optic nerve is thicker than the usual.
That's probably the reason you were asked to undergo a precautionary checkup every year. You can have the visual field analysis and OCT today. And once you receive the 2 test reports, let's meet again in the afternoon.
Okay, doctor.
Yes, Mrs. Dominica?
Hello, sir. The doctor advised me for these 2 tests.
Okay, The 2 tests would cost you £200, and you'll get the test reports in around 3 hours. Is that okay with you?
That's fine.
Please be seated here. Someone will call you back for the first checkup in just a few minutes.
Thank you, sir.
Hello, Mrs. Dominica. I hope you had a good experience going through those 2 tests.
Yes, it was. And since I've taken the test before, I know what to expect.
Your test reports are perfectly okay. Since these reports haven't shown anything suspicious in so many years, I think you can now take these tests once in 2 years and not every year.
Okay.
Well, that puts the glaucoma thing to rest. Do you work on the laptop for long hours?
Yes, doctor. Being the chief accountant, I have to work all day on computers.
If your eyes become tiresome very quickly, I will recommend an eye drop that can be applied thrice a day. Generally, the eyes become tiresome when we continuously look at the computer screen without blinking for long. In such a case, this eye drop would lubricate the eyes.
Actually, I see a few black, thin, wavy structures floating before my eyes that don't disappear even after closing my eyes. What are they? Will it cause any serious problems to my eyesight?
Not actually, they're called floaters. As we age, floaters develop to different extents. They're not harmful. Actually, floaters may appear like gray or black specks, cobwebs, or strings that float during eye movements and appear to break away when you look at them directly. Generally, most eye floaters are caused due to age-related changes that occur as the jelly-like substance called vitreous inside the eye becomes more liquid.
Are they very serious, doctor?
Getting a new floater or the appearance of light flashes are the signs that the vitreous gel is pulling on the retina that can lead to a retinal detachment, a serious condition that can be treated with a surgery.
Can anything be done about the floaters in the eye?
Rarely, floaters may become very dense and plentiful and affect the eyesight. In such cases, a surgical procedure called vitrectomy may be suggested to remove floaters from the vitreous. A vitrectomy is performed to remove the vitreous gel along with the floating debris from the eye.
How can I get rid of floaters, doctor?
Normally, most of the eye floaters don't require treatment. It requires some patience and caution to get rid of them over time. When floaters become so large or numerous, they can impair the vision.
What kind of vitamins will be effective to treat floaters?
Although our government doesn't approve the Food and Drug Administration for treating floaters, there is anecdotal evidence that intake of vitamins can improve the eyesight and reduce the dominance of floaters. You can take a vitamin A supplement that includes selenium, magnesium, and DHA, as these nutrients help to treat floaters.
Can you suggest to me some foods that will be effective to control my eye floaters?
Well, you can indulge leafy green vegetables like spinach, kale, and collards in your meals. You can also have salmon, tuna, and other oily fish, eggs, nuts, beans, and non-meat protein sources. Citrus fruits or juices such as orange, oysters, and pork in your diet.
Thank you, doctor. Thanks for your time.
You're welcome. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now look at question 25. You hear a physician and scientist making an announcement on a finding. Now read the question. A major depressive disorder is one of the most severe, troublesome, and costly psychiatric diseases. Although there are pharmacological and non-pharmacological treatments, often antidepressants are used more frequently than psychological interventions due to inadequate resources. Our efforts are to promote the evidence-based prescription of these antidepressants in the future. Therefore, we are now focused to update and expand our previous efforts to compare and categorize antidepressants for treating a major depressive disorder. All antidepressants were more efficacious compared with placebos while treating the adults with a major depressive disorder. While the effect was lesser in the placebo-controlled patients, the variation in efficacy and acceptability was more in the patients treated with antidepressants. Therefore, these findings should promote the evidence-based prescription of antidepressants and apprise the physicians, patients, and policymakers on the merits of various antidepressants. One of the most crucial challenges worldwide is the routine prescription of antidepressants for the treatment of a major depressive disorder. Nevertheless, in the scientific literature, there are considerable ongoing debates about the effectiveness of antidepressants, as well as the potential differences in tolerance and effectiveness due to individual drugs. With the introduction of new antidepressants into the market, and the increasing numbers of trials published every year, we have realized the significance of systematic review and meta-analysis to synthesize the evidence in this crucial clinical issue. Question 26. You hear a physician explaining the issues involved in treating lower back pain. Now read the question. Lower back pain is one of the crucial issues in the medical field leading to disability, and it's growing alongside the aging population, which are more rapid in low-income and middle-income countries, where adequate resources to deal with this issue might not exist. Therefore, the impacts are probably extreme in such regions. Most of the lower back pain issues are unrelated to particular identifiable spinal abnormalities, and this announcement is an alert for action on the global issue of lower back pain. Typically, most of the clinical practice guidelines suggest similar approaches for the investigation and treatment of lower back pain. Their suggestions include the use of biopsychosocial strategy with initial non-pharmacological treatment, including the suggestion of self-management and resumption of exercises, normal activities, and psychological programs for those with continuous symptoms. Nevertheless, recommendations are mainly based on the trials exclusively from high-income countries, focusing mainly on treatments rather than its prevention. Therefore, there is a massive gap between evidence and the existing practice. Without the use of suggested first-line treatments and inappropriately high use of imaging, spinal injections, opioids, and surgery. Following similar strategies will never reduce back-related disability or its consequences in the longer run. The effective treatment will be those which align the evidence with practice, focus less on spinal abnormalities, and suggestions of activities including work participation. Although we have devised effective and promising solutions that require greater attention and intensive research to establish whether they are suitable for larger-scale implementation. These potential solutions include the redesign of clinical pathways, focused strategies to implement best practice, integrated health, and occupational interventions to reduce disability with prevention strategies. Question 27. You hear a doctor explaining to the nurses about the growth hormone test. Now read the question. Growth hormone test.
The growth hormone is very essential for the human body to grow. To find out why the growth of a child is slow, a growth hormone test called arginine and clonidine stimulation test is performed that will indicate the secretion level of growth hormone in the body. The child will be injected with two types of medicines during this test, namely arginine and clonidine, that will cause the body to secrete the growth hormone. Biochemically, the growth hormone reserve of the child is defined by the peak serum concentration after stimulation with a known secretagogue. While performing the test, nurses draw 5 blood samples at specific intervals to observe how many growth hormones the body is secreting. Prior to the test, the child should not be allowed to eat or drink anything except water after midnight. The test takes about 6 hours, so the child should be clothed comfortably. Generally, a short-sleeved shirt is suggested during the test. The nurse on duty should make sure whether the child is on any medications before scheduling this test, and they should explain to the parents of the child about the process and outcome of this test. The test will be performed in an endocrinology outpatient clinic, and the nurse should measure the weight and height of the child. Then the child will be taken into the patient room equipped with the intravenous catheter, which is used to inject the arginine into the child and to take the blood samples. However, the clonidine will be fed through the mouth in liquid or in pill form. This may lower the blood pressure and cause the child to sleep, so the nurses should keep on measuring the blood pressure of the child during various intervals. The child may be given fluids to drink during the test. However, before discharging from the clinic, the child should be able to eat and walk around. The child may feel tiresome throughout the evening.
Question 28. You hear the announcement of a new milestone in cancer treatment. Now read the question. A milestone in cancer treatment. Cut, burn, and poison is the expression that describes the traditional 3 steps involved in the cancer treatment. Specifically, the expression means to cut out the growth of the cancer tumor, burn the carcinogenic cells with radiation, and poison those that remain with chemotherapy drugs. Interestingly, a young doctor from the U.S. proposed another method to treat cancer about 30 years ago. He thought that abandoning the blood supply to cancer tumors could block their growth, but many scientists dismissed this concept for a long period. However, last month, the Food and Drug Administration of the U.S. approved the drug called Avastin that works the way he proposed. Although the drug does not cure the cancer, it increases the lifespan of the patient with colon cancer. Avastin is a genetically engineered protein that connects with the protein in the human body that promotes the growth of the blood vessels. The protein, also known as vascular endothelial growth factor, intervenes with the supply of blood to cancer and starves the cancer cells. Avastin targets the weak places of cancer cells, though it does not damage normal tissue. Whereas chemotherapy kills cancer cells, and also the other normal cells resulting in infections along with stomach and intestinal problems. There are also other drugs being tested to investigate whether they can stop the formation of blood vessels. In the past 2 years, Avastin is one of 3 new drugs approved for colon cancer. Question 29. You hear a physician explaining how to treat an intermittent explosive disorder. Now read the question. Intermittent explosive disorder. The intermittent explosive disorder involves spontaneous, impulsive acts of aggression that may take the form of spells or attacks. The symptoms may begin minutes or hours before the actual act. A person with the intermittent explosive disorder may have the frequent history of such occurrences. The intermittent explosive disorder can be connected to something in our surroundings or some kind of action within our body. Due to the abnormality in the area of the brain that controls the behavior, some people may show more explosive behavior, while others may develop the intermittent explosive disorder as a result of a severe explosion or violent actions occurring around them. People with the intermittent explosive disorder often show aggressive behaviors that are impulsive, and they often become out of proportion to the situation. They may experience the feelings such as rage, a racing heart, irritability, or sudden burst of energy. Often the patient with the intermittent explosive disorder will feel relieved from built-up tension, while many with such a disorder blame others for causing them to outburst aggressively. However, they also feel guilt and remorse after the outburst. There are various types of drugs to control the intermittent explosive disorder temporarily, such as certain anticonvulsant mood stabilizers, antidepressants. However, the therapy involving cognitive exercises challenging their negative perceptions was found to be effective in controlling the intensity and frequency of intermittent explosive disorder. Question 30. You hear a doctor briefing the junior doctors about trigger point injection. Now read the question. Trigger point injection. Often muscle spasm prolongs and doesn't respond to regular treatments like ice and heat, physiotherapy, or muscle relaxants. In order to relax the muscle, either a local anesthetic or a combination of local anesthetic medication and a steroid medication will be injected into the tight bundle of muscles known as trigger points. In this process, the skin of the patient will be cleaned and chlorhexidine and a small needle will be inserted into the trigger point muscle. Generally, up to 4 trigger points are injected in one session. However, when injecting up to 10 trigger points, the patient will feel very painful. It is essential for the patient to inform the physician when the needle contacts the painful trigger point, as this is where the medicine has to be injected. They may feel a temporary discomfort. There can be many possible complications after a trigger point injection, including mild bleeding and skin irritation and infection. Although the positive result of the treatment cannot be ascertained, the local anesthetic will numb the area for 3 hours. The corticosteroids remain in the tissue in active form for about 1 month. This is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 through 42, choose the answer A, B, or C, which fits best according to what you hear. Complete the answers as you listen to the audio. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a medical podcast on the guidelines for coping with Prader-Willi syndrome. You have 90 seconds to read questions 31 to 36. Hello, Mrs. Araceli. I am Dr. Gonzalez.
Hello, doctor. I would like to tell you something about myself.
Yes, please.
I have been married for 55 years and we have 3 children. The second child, who was born in 1964, had every kind of physical problem and was in the hospital for 10 months. However, we did not have a diagnosis until she was 4.5.
What does the diagnosis indicate?
Prader-Willi syndrome.
Prader-Willi syndrome?
Yes, it had a severe impact on my child in very complicated ways, mainly the damage of the 2 primary areas of the brain, the deletion of chromosomes 15 and hyperplasia. She is always feeling and thinking about food the whole time, akin to the feeling of starvation, and she never has the feeling of satiety. So this affects her daily life in an extreme way, and her tolerance level and the temper control, which is affected greatly.
Over the years, you would have experienced the communication skills of your doctor a lot. What is your impression in general?
We've been very fortunate for not having any bitter experience over the diagnosis. However, later on we have realized that he had suggested blood tests for her that were not actually required. That was the only bitter experience we had.
Actually, Prader-Willi syndrome is a complicated genetic condition that severely impacts several parts of the body. In infancy, this condition is identified by weak muscle tone called hypotonia, difficulties in feeding, poor growth, and delayed cognitive development. The patients develop an insatiable appetite right from the childhood, resulting in chronic overeating called hyperphagia and obesity. Some patients with Prader-Willi syndrome, especially those with obesity, also develop the most common form of diabetes called type 2 diabetes. The patients will typically have mild to moderate intellectual impairment and cognitive disabilities. Behavioral problems are very common, such as stubbornness, temper outbursts, and compulsive behavior. Sleep abnormalities can also be seen in the patients. Distinctive facial features such as almond-shaped eyes, triangular mouth, and a narrow forehead. Short in height, small feet and hands. Patients even have light-colored hair and unusually fair skin. Male as well as female patients will have underdeveloped genitals, delayed or incomplete puberty, and infertility is also common.
So is there any chance of curing Prader-Willi syndrome, doctor?
Yeah, but it's a lengthy process. Parents can enroll infants with Prader-Willi syndrome in early intervention programs. However, even if the diagnosis is delayed, treatments are available at any age. Therefore, for the patients with Prader-Willi syndrome, the types of treatment depend on the patient's symptoms. You can adopt any of the following steps that are suitable for the patient. Can use nipples or tubes for the patients with feeding difficulties. Special nipples or tubes have to be used for several months to feed the child with feeding difficulties, to make sure that the infant is fed completely and it has proper growth. The healthcare provider will monitor weight, height, and body mass index periodically to ensure proper growth. By supervising the daily food intake, the parents could prevent the overeating behavior that starts from 2 to 4 years of age. This will minimize food hoarding and prevent rapid weight gain and obesity. Growth hormone therapy has to be performed to increase lean body mass, mobility, and height, to reduce fat mass, and improve movement and flexibility from infancy through adulthood. If the growth hormone therapy is given early in life, it may reduce or prevent behavioral difficulties. In addition, this can help improve speech, cognitive ability, abstract reasoning, and often promote information to be processed very quickly. It also improves sleep quality and resting energy expenditure. Growth hormone therapy is usually started during infancy or immediately after the diagnosis, and often continues during adulthood at 20% to 25% of the recommended dose for the patient. Many patients have trouble getting their eyes focused together. Such patients should be referred to a pediatric ophthalmologist. If necessary, an orthopedist will evaluate and treat the curvature of the spine called scoliosis. Sleep disorders are very common in Prader-Willi syndrome patients. Treating a sleep disorder in an early stage would help improve the quality of sleep. Muscle weakness is a serious issue among the patients with PWS. For children younger than 3 years of age, a physical therapy is essential to increase muscular strength to achieve developmental milestones. Generally, the patients have difficulty in controlling their emotions. Therefore, a behavioral therapy could help to control anger, obsessive-compulsive behavior, and stubbornness, including an obsession with food. Medications, such as serotonin reuptake inhibitors, may reduce obsessive-compulsive behavior and also help manage psychosis.
Thank you very much, Doctor. That's been really useful. Thank you.
Thank you, Mrs. Araceli. Now look at Extract 2, questions 31 to 36. You hear the guidelines given by the physician on how to cope up with Prader-Willi syndrome. You have 90 seconds to read questions 37 to 42. Rejection of kidney transplant. What should I do? Rejection is the primary and prominent complication that may arise after receiving the kidney transplant. Since the individual was not born with a transplanted kidney, his body will consider this new tissue is foreign, and as a result it will try to attack the new kidney to protect the body of the individual. Rejection is a common response of the body after the transplant surgery. Therefore, the patient must take appropriate anti-rejection medicine as prescribed to prevent rejection. There are two types of rejections that occur after the kidney transplant. 1. An acute rejection occurs usually any time during the first year of transplant and can be cured successfully, whereas a chronic rejection occurs gradually over years. The causes of chronic rejection are yet to be identified by the research, and the treatment of chronic rejection is often unsuccessful. Immunosuppressant or anti-rejection medicines decrease the natural immune response of the body to the new foreign organ. The medicines repress the immune system and prevent the body from rejecting the new organ. However, there are also chances of getting cervical, colon, and breast cancer in women and prostate and colon cancer in men. Significantly, it is very difficult to diagnose the kidney rejection in its early stages. Also, the rejection is often irreversible once it starts. Therefore, the organ recipients should never stop taking the anti-rejection medication even if they think the new kidney is functioning well. Discontinuing the anti-rejection medication will encourage a rejection to occur. The numerous side effects of the immunosuppressant or anti-rejection medications are usually manageable by the patients. Blood levels after having anti-rejection medications have to be examined regularly to prevent rejection and reduce the side effects. High blood pressure, weight gain, getting infections, and an increased risk of certain types of cancer are some of the common side effects of immunosuppressant medications. The three groups of immunosuppressant medications are induction agent, a powerful immunosuppressant medication given before the transplant or immediately after the surgery. Maintenance agents are the second group of immunosuppressant that have to be taken regularly throughout the lifetime. Rejection agents are the medications that are used for treating the kidney rejection. However, since the immunosuppressant medicines lower the immune system, there are high possibilities of viral and other infections. Therefore, diagnosing and treating the infections at the initial stage is the best method to maintain the body and the new organ healthy. It is very essential to wash the hands frequently or to use an antimicrobial gel during cold and flu season. The patient should report to the physician following any of these symptoms: sores, injuries, or wounds, especially those that do not heal, symptoms of urinary tract infection like a frequent urge to urinate, pain or burning sensation while urinating, reddish or cloudy or bad-smelling urine, symptoms of respiratory infection such as nasal congestion, cough, sore throat, and scratchy throat, running nose, or a fever. There are certain vaccines that will protect the body from infection. Also, certain vaccines are not good for a transplanted patient. For instance, the patient should avoid all live vaccines. Therefore, the patient should consult the transplant team before receiving any boosters or vaccines. The following are the common rules for receiving vaccines such as live vaccines, a flu shot, or hepatitis B. Hepatitis B should be received before transplant. Should avoid all live vaccines. Should avoid the nasal influenza vaccine. Should wait for at least 6 months after transplant or receiving a flu shot. Afterward, get a yearly booster injection. The patients who receive a live vaccine should avoid direct contact with the children received oral polio vaccine for 3 weeks. The children received measles or mumps vaccines. The adults received attenuated varicella vaccine to prevent zoster. The adults or children received the nasal influenza vaccine. The recommended vaccines are Haemophilus influenza B, diphtheria pertussis tetanus. Hepatitis B is safe before transplant. Hepatitis A should be given before traveling. Neuromax, single booster after 5 years of transplant. Influenza types A and B yearly. Inactivated polio. Meningococcus. Typhoid 6. The following live vaccines should be avoided: varicella zoster, smallpox, live oak typhoid, TY21A, and other newer vaccines, intranasal influenza, Bacillus calmette-guerin, yellow fever, mumps, rubella, oral polio, live Japanese B encephalitis vaccine, and measles. except during an outbreak. The patient may develop diabetes after the transplant even if he did not have any diabetes earlier. This kind of diabetes is known as new onset diabetes after transplant, or NODAT, that can occur as a side effect of the anti-rejection medications. Kidney recipients are often at greater risk for heart disease. The many causes for heart diseases are diabetes, smoking, hypertension, overweight, high cholesterol, blood lipids, hypertension, and prolonged periods of dialysis. There are increased chances of cancer formation after the transplant. Therefore, it is very crucial to keep maintaining the immune system to prevent cancer formation. Since the immunosuppressive medications decrease the immune function, that will obviously decrease the defensive mechanism of the body against certain types of cancer, there are things that you can do to lower your chances of getting cancer. The most common type of cancer is the skin cancer that can result in the fatality of a patient. However, there are also chances of getting cervical, colon, and breast cancer in women, and prostate and colon cancer in men. That is the end of Part C. You now have 2 minutes to check your answers.